the thing in President Obama's State of the Union speech that I thought was most important to kids in the budget is when he said that he was not going to let health reform die. Because health reform through the federal Medicaid program and potentially through the federal subsidies to struggling families will mean dollars for children, for teenagers, and for kids' parents, which is also good for kids. I think, though, on the question about the freeze on discretionary spending, there's a technical difference in the way the federal government gives out money between discretionary and entitlement or mandatory programs. And our look at children in the federal budget showed several mandatory programs, not under his freeze, that are really important for kids. Besides Medicaid, food stamps, nutrition programs, and even Social Security was in the top 10 for older kids. On the discretionary side, there are some very important programs for children, dollars for education, for childcare, for Head Start. They're smaller, but they're crucial, and the president indicated a strong priority for them. So I think the question of what does it all mean when he tries to apply his freeze and his priorities, I'd advise people who care about children to keep making the case that among those programs, those are the top priority ones to keep moving on.
Well, I probably would come out very close to Olivia, but I guess I would reframe the issue in terms of what provides the best bang per buck. So there's really two separate issues. One is how much of the federal budget do we devote to children, to the extent that that's an important issue relative to other needs in society. But all of that has to relate to what type of return do we get. And I would suggest that there are a whole variety of areas that we get a significant return out of. And actually, I think that Olivia's list actually is largely formed by that type of calculation. Very high on my list would be those investments that go towards education. In the healthcare area, I would probably try to emphasize much more preventative care, and that's because I think we face in a whole variety of government programs, not just children's programs, at times the ability of providers to capture the intended subsidy so it doesn't get to children. So to give an extreme example, how much money do we pay for $400,000 a year surgeons versus $100,000 a year pediatricians? Would be hard to calculate program by program, but indeed I think that's the type of thing you have to ask. So I would say where the investment's highest, gets the highest returns, where there's preventative care, and where we're actually putting forward and gathering good data to try to measure that as we go along.
One of the interesting things about both of our answers that I think is different from the way people have the budget debate is that we're not necessarily talking about just big categories of programs. We're talking about ways of spending on children to achieve outcomes. And I think that's actually been a result in some ways of the children's budget work that you had the idea about, that it led us to see, wait a moment, you can't just say entitlement discretionary, you have to look at the ways in which food stamps and Medicaid and discretionary programs fit together for children. And that ability to look at that more subtle question, I think, is partly what that project has done.
The other thing I'm thinking of too is there's research now where a number of people have come to the conclusion, Jim Heckman at Chicago is among them, who believe that some of the highest returns go to investing very early in children. I think of it as actually not requiring a very elaborate theory, because in some sense we always know that if you invest early, you can compound returns over a longer period of time. And so that's an example of trying to really think through where we get the best investment in children. Although I think both of us would not want to only invest in young children. Right. We think there's a lot of areas where we're neglecting real needs of our younger people.
Another insight that came from the children's budget work is that when you look at total public investment, federal and state, which you have to do because states are 2/3 of the spending on children, what you see is we're actually investing in the opposite way. We're investing less in young children, more as kids get into school, and probably our biggest gaps are for very young children, babies, toddlers, and for young people in the teenage to young adult range, particularly those who are not staying in school. So I think that, again, is something that till we did the analysis by age group and tried to look at both federal and state was hard to see.
And another thing we discovered, you emphasized health, another thing we discovered there, I guess we started to do it, but it was nice to get the numbers, is children's health isn't very expensive. The grand scheme of the health rate or anything else, it's actually relatively cheap to figure out how to cover children if we just be willing to at least bite that part of the apple.